Morning Buzz is a monthly networking opportunity that keeps you in tune with the heartbeat of our local business community. Each month, Park Rapids Lakes Area Chamber and Chamber ambassadors will interview Chamber members. The participants will have an opportunity to share what's currently going on with their businesses. So we'll still be able to share a little bit afterwards. All of those that have joined, we'll give you just a little bit of time to share what's new, what's going on with you. And so what I'd like to do right now is introduce one of our ambassadors, Dan Pike, and he'll introduce our host for today. Dan?
Thanks, Candy. I am Dan Pike. For those who don't know me, most of you probably do, but I'm a member of the Park Rapids Chamber Ambassadors, and today I'm going to be doing our new interview series of Morning Buzz, and we have Kim May with us today, who's the Clinic Operations Director for Essentia Health, and Dr. Michelle Timon, who is the Medical Director. And they're going to talk to us about what's new with them, how COVID has impacted the healthcare industry and their business a little bit, and take time for a few questions at the end as well. So whoever wants to start, if you want to just talk a little bit, that'd be great.
Sure. Good morning. I'm Kim May, the Clinic Operations Director for Essentia Health. Grew up in Park Rapids and have been with Essentia Health for 22 years. Thank you to Candy and Dan for inviting us to be a part of your first podcast. It's very exciting. I know it's a little bit different in the virtual world that we live in, so it's very nice to see everyone's faces that we can have our cameras on. Dr. Timon, do you want to do an introduction before we start?
Sure, yeah. Hi, I'm Michelle Timon. I'm a family medicine physician with Essentia. I'm the medical director here in the Park Rapids, Walker, Monaga area. And I also have the privilege of helping to assist with the primary care clinics in Detroit Lakes, Boston, and Ada, Minnesota as well. I've been with Essentia since 2008. I recognize a lot of faces on this call this morning, so that's fun to see lots of people that we know. We've got lots of exciting stuff to share with you all. I'm sure there's quite a few questions, lots of buzz out there about COVID and vaccines, and there are other people on this call I see who may have thoughts to share about the vaccine as well. I'm looking at you, Ben Koppelman. So, so thank you for having us, and we're glad to be here.
Awesome. Well, thank you guys very much. So I got a list of questions here I want to ask, and you can go ahead and take turns or both answer questions if you'd like. First question I have for you is, how has Essentia Health responded to the COVID-19 to ensure that their patients can receive safe care within their facility?
I can take that one, Dan. So as many of you come to our facility, you'll see signage. We have implemented screening all of our patients and visitors and employees that come into the building. They're asked a series of questions regarding exposure, regarding travel, and regarding symptoms. We have established a respiratory clinic where once our patients are screened, or if they call to schedule and they know that they have a symptom, that we have a process for them to receive safe care and to socially distance. All of our waiting room furniture, all of our furniture in our facilities have been adjusted so that we are able to socially distance. We do require continuous masking, which would cover the nose and the mouth while in the facility. Apologies. We also have visitor restrictions. Patients are allowed to receive care. They're also allowed to have a visitor if they need a visitor with them, whether they're a minor or an adult. We have also adjusted in this COVID world and really ramped up our technology and have been able to provide care in multiple different venues. Patients are able to receive in-person, face-to-face care. We also offer virtual visits to our patients, which is guided by our providers when it's appropriate for a patient to be seen virtually. Patients have access to 24/7 virtual visits, so 24 hours a day. We also have an RN triage team that's able to provide care to our patients. And we do e-visits, so electronic visits, which don't require a video. So it's similar to messaging or emailing back and forth with the providers. So multiple different venues for our patients to receive care. We also provide telehealth services. So a patient can come into the facility and they can be roomed by our team, and they can connect with the provider via video visit as well. So on the screen, so the provider could be in Duluth, Fargo, Brainerd, and the patient is able to come to our facility and receive their care here. Our main goal with all of the processes that we've implemented, again, is to protect our patients and our team and our community, minimize the risk of exposure to COVID, and for our patients to still be able to receive their care close to home and to know. Our cleaning processes in our facilities have been increased. We clean a lot more frequently than we ever have. And our patients are provided the proper protective equipment when necessary. All of our team members, they have PPE to wear to, again, help minimize the risk of exposure or spread. So we've done a lot of things, so.
That's great. Thank you for letting us know about that. A couple other questions along those same lines now. Personally, I was tested at the Essentia clinic here in town myself earlier this spring, earlier this winter. But, how does that testing process go for people who haven't gone through that before? And is that offered for everyone? And how does that work?
Absolutely, yeah. You can right now, if you are a MyChart user, you can actually initiate your own test. You can self-request. We have patients that are seen in our respiratory clinic that are tested in the facility. And we also have a drive-through testing at our Park Rapids Highway 34 clinic. So patient is either seen virtually in a visit or they've requested their own testing. And then they can do everything on the MyChart app, and they can go through the drive-through testing to have the collection done.
Follow up on that. Is there a fee associated with testing?
Yes. Sometimes it's billed to insurance, and sometimes there's no fee. It really depends on the venue that the request is coming from. So.
Oh, that's great. Thank you for telling us on that and letting us know. And I'm sure too, some people will maybe want to do some traveling, things like that. What is the turnaround time on testing usually lately?
We've been seeing a really good turnaround time. Results typically within 48 hours. All of our testing, we've been collaborating with the Department of Health and Mayo Clinic for our testing, and our turnaround times have been good the last, I would say, 3 to 4 weeks.
Awesome, thank you. And now you touched briefly already on MyChart a little bit, and tell people who aren't maybe familiar with that, what exactly that is.
So MyChart is a very cool app that you can load on your device. What it does, it allows you to schedule appointments, communicate with our care team and your provider. You can pay a bill online. You can view your medical record, request a medication, message anyone. It's very seamless and very easy to do. If you go to the essentiahealth.org website, on the kind of the right hand upper corner, it'll say MyChart enrollment. You click on that, or you can download the MyChart app and then enroll that way. But it's very seamless and very user friendly. That's the main venue that our patients can request their own COVID testing as well.
Yeah, I'll just add on to that. So, historically, traditionally, when patients want to reach out to their provider, it's a phone call to the clinic, which if any of you have ever done that before, you appreciate it's not a seamless process. The phone call comes into our answering team. They take a message, it gets forwarded to a nurse who deals with it if that's possible. If not, then it finally gets forwarded to a provider. And it can take a number of hours for a provider to be able to return a phone call, not because we're sitting around drinking coffee, obviously, it's because we're busy seeing patients. A MyHealth message, on the other hand, while it still gets triaged by a nurse, because again, the nurses can oftentimes manage whatever the question is, if they're unable to, then it simply just gets forwarded to us. And honestly, as a provider, it is so much easier to respond to a MyHealth message. It takes me, 30 to 60 seconds. I can do it quick between a couple of patients, or during my lunch hour, or even at 8 p.m. when I'm at home trying to catch up on stuff. So it's a lot more, I think it's a faster turnaround, and I think it's a lot more friendly for everybody involved to use it, whenever possible.
Yeah, I can imagine too, it's kind of that whole phone tag thing you'd be playing otherwise with some patients, and obviously with my business too, I see that as well. And so, yeah, definitely I can see how that's great. So what are the services that you guys do provide here in town? I know you did touch on it a little bit, but just to reiterate on that.
Sure, I can speak to that. So our primary service in town is primary care. So family medicine, internal medicine, pediatrics. This means providing care from, before birth, prenatal care, all the way through end of life care in conjunction, sometimes with home care or the hospice program. That's how most people, how most patients interact with us here in Park Rapids. As part of primary care, we also have access, of course, to all sorts of testing, whether it's lab testing or x-ray. We also have great colleagues in the world of behavioral health therapy, so counseling services, as well as some medication management, physical, occupational, speech therapy. So lots of great people that we collaborate with when we're working, to manage our primary care patients. We also have on-site services for orthopedics 5 days a week. We have podiatry a couple of days a week. We have surgical services, of course, provided here in the clinic, along with the surgical procedures provided over at the hospital next door. And then we've got a number of specialists who either come to Park Rapids physically to see patients or can provide telehealth services like Kim talked about earlier. That includes basically all of the ologies, as we call them. So the cardiology, nephrology, I could go on and on. So rheumatology, we've just got lots of great services that we can provide to people, both physically here in Park Rapids and then again in this building, but through a telehealth process. Kim, did I leave anybody out? I hate to do that if I did.
No, the one thing that I can add though is, we do have pediatric services with Dr. Dahl and Greg Johnson, but recently we've added a team member to our pediatrics team. Her name is Dr. Sarah Frenning. Our PEDS team is phenomenal. They collaborate with PEDS specialists when necessary, but they are really able to provide a lot of that care to our kiddos here at home. So she's been a wonderful addition to our team as well.
Yeah.
Awesome, that's great. Seems like you guys have a good array of services here for your patients. That's great to hear. Two other big questions here, and you can answer them in whatever order you would like. Number one question is, is the vaccine available? Who is it available for? Are you guys going to have it available? And what does the timeline look on that? And then second question, of course, if you want to speak on, what can you tell us about the letter of intent between Essentia Health and Common Spirit Health?
Well, let's take the vaccine question first. So in some ways, we are, not in some ways, we are basically learning daily what we have and what we have access to. As many of you know, I'm sure, the the state of Minnesota really controls the rollout of vaccine, where it goes, in terms of which locations, who's eligible to receive it, et cetera. And of course, the state is dependent on what they're getting from the federal government. So it all kind of trickles up. With regard to that, we're very happy to say that all healthcare workers within Essentia, or I should say even all staff within Essentia, have been offered the COVID vaccine with a very high rate of reception. So that's been great. We've got everybody, I think we'll be completely done with second doses by the end of this week. So we're feeling really good about that. We've also been working with our teammates over in Detroit Lakes with regard to our ability to roll that out to the public, which will be the 65 and older group to begin with. And I'll let Kim to speak to some details on that. But one of the things that's, I think, going to be really key here is, again, the MyChart app, because what we anticipate doing is sending out notices through MyChart to patients who are eligible when we've got vaccine to offer them. And so I've actually had some patients already receive that notification, not from us here specifically, but saying, we've got vaccine, you're kind of in our area where we can give it to you, you live in our area. And so if you want it, schedule your appointment online. So that's our primary way of communicating. That being said, we have a lot of patients who are not on MyChart. So that will not be our only way of communicating that by any means. We want to reach everybody. So that's going to entail probably a number of phone calls. We are talking to people when they come into the clinic. A lot of people have questions about, should I get the vaccine? What are reasons why I wouldn't get the vaccine? And I'm happy to tell this group right now, there's very few reasons why you should not get the vaccine. Reason number one is because you actually have COVID right now and you're on quarantine. We really don't want to see you. But once you're out of quarantine, you're eligible for the vaccine. Reason number two, if you've had the monoclonal antibody infusion, which is a medication we're working in conjunction with the hospital to identify patients who qualify for that infusion, and then they can receive the infusion over at the hospital. If you've received that within the past 90 days, you're not eligible for the vaccine. So you need to wait through that 90-day period. And then the other reason to not get a vaccine is if you've had a different vaccine within the past 14 days. There needs to be a 14-day window on either side of the COVID vaccine where you're not receiving any other immunizations. The only other reason to not get a COVID vaccine is if you've got a specific allergy to an ingredient in the vaccine, which very few people do. And if you've ever had an allergic reaction to an injection, that would be a conversation you'd want to have with your provider before signing up for the vaccine. But again, that's going to be a very small minority of people. Kim, do you want to talk a little bit about our plans to roll it out here in Park Rapids?
Yeah, absolutely. Thank you, Dr. Tiemann. We are working with our coalition, which I know the hospital is included in as well, and with the Department of Health to roll out our phase 1B, like Dr. Tiemann said, so it would be patients 65 and older. Because of our space and the ease of access and the ability to socially distance at our Park Rapids Highway 34 clinic, that is likely the site that we will be administering the vaccines to the general public. Timeline, like Dr. Tiemann said, we are really working closely with the Department of Health, and so don't have a definitive timeline as to when we will have vaccines available. But we are working on identifying patients that are eligible and will likely begin reaching out to them hopefully within the next few weeks.
I think one thing to keep in mind too is the efforts that the state is doing specifically. As of today, many of you probably know, they opened again the 24-hour window for patients who are 65 and older to call and put their names basically on the waiting list. And so, if you've got friends and family members, if you yourself are in that category, I would certainly encourage you to do that. I don't have that phone number on me, but I imagine if you go to the Minnesota Department of Health website, it's probably right there in the front. So they're really promoting that. And And the strategy there is, let's put people on a list, and then they will randomly reach out and say, you've been selected to receive a vaccine. If you would like to do that, schedule your appointment. Last week they tried just to schedule appointments, and the site crashed and burned pretty hard. So I think it's good to try a new strategy this week. I think they're hopefully have a little bit more success with that. And then of course there's the pilot sites that the state is rolling out, specifically geared towards teachers and childcare workers. I believe that the closest site to us is Thief River Falls, which is a little ways away, obviously. But the schools should be working directly with the educators to work on getting them signed up for those vaccination sites. And my understanding is that the childcare workers are receiving communication directly from the state as well as to when they are eligible to sign up for that. So lots of different efforts going on, and I think, which is great, honestly, because we need a lot of different efforts going on. I'm sure the hospital and the community health department is also working on their strategy. I don't want to put words into Ben's mouth necessarily, but I think there's going to be a lot of different ways to receive vaccine in the area over the coming weeks.
Awesome.
Oh, go ahead.
I was just going to say that's great. Yeah.
Yeah. We can turn our conversation to your second question about the letter of intent between Essentia and Common Spirit. So I think it's safe to say that all of us involved in this conversation are pretty excited about the opportunities that this brings to us. Park Rapids we've been very fortunate, I feel, to have a number of different healthcare organizations within our area collaborating to provide good care to patients. It's really exciting to think about what we're going to be able to do when we're all doing it together. I think there's just lots of really amazing opportunities to provide more seamless care. One of the challenges we have is that Essentia and Sanford both operate on one particular electronic record, and CHI operates on a different one, which can cause just some delays sometimes with sharing information. The communication between everybody isn't always perfect either. I mean, again, when you're not working within the same organization, things fall through the cracks sometimes, at no fault of anybody's. It's just the nature of the beast. So personally, as a physician here in town, that's what I'm the most excited about, is to know everything that goes on with my patients, because I get those records, I see what's happening, I receive, messages or emails or phone calls or whatever from the people in the hospital taking care of my patients, and vice versa. And so I just think the quality of care we're going to be providing to patients in this area, I think it's good already, but I think it's going to be just honestly pretty awesome moving forward. So we're just really excited about this opportunity. There's a lot of background work still to be done, of course. There always is when there's these types of conversations, and lots of people with lots of questions. How does this affect me? How does this affect my job? How does this affect my care, et cetera, which are all very, very understandable. And I think we just ask for patience as we kind of slog through this and figure it out, and identify, what exactly are the opportunities, what are the challenges, and how do we work through them. So it's pretty exciting. Kim, do you have any comments about it?
There, I'm unmuted. Yeah, this opportunity is very exciting for the communities that we serve, for our teams. And it's, a letter of intent is the first step in the process. And we just really look forward to working together to provide the best care to this community. So very exciting.
Who is the letter of intent involving? Is it Essentia and other organizations, or who is it?
Yeah, it's Essentia Health and Common Spirit Health. And so really, it's an opportunity for CHI facilities in North Dakota, Minnesota, across for us to be joining forces. So very exciting.
That's great. That's great. Do you have any other comments that either of you want to make at this time, or should we open it up for some questions here?
Yeah, we can open it up. That sounds good.
Yeah.
Mhm.
There was a, put on the news this morning, you just briefly touched on the website that you could go in Minnesota and put your name on to sign up. Do you know what that website is? Is it minnesota.gov or?
Well, it would be the Minnesota Department of Health. So I think if you just Google MN or MDH, I think is their initials.
I put it in the chat. So if you look in the
perfect.
chat,
Thank you.
there's the part on the vaccine is right in the chat. So go ahead and click on that for you, Cheryl.
Thank you.
Thank you, Candy.
You're welcome.
Any other questions?
I guess I'm intrigued by the merger side of it. Good morning, everyone. Great presentation. And I think it's, I'm really excited to see the organizations coming together. And to the general public, I'm guessing that this merger or this letter of intent and future merger and adding these will add just additional services and open up a network of more specialty type services that would be available. Is there, that's my hunch. Is that kind of what we anticipate?
You know, unfortunately, at this point, the details of all of that are up for discussion. But I would anticipate any type of merger of systems like this. There's always opportunity to improve the care that we're providing, to increase the care that we're providing, and to really make sure that we're best serving the community. And I can say that Ben and his team have done a phenomenal job of, working through the community needs assessment and really focusing on the areas of opportunity and how do we best serve this community. So they've done a great job. And I see Angela's on. She's been a part of that. So yeah, kudos to them.
Any other questions?
I don't have a question, but I just have to compliment the team of healthcare that we do have here in Park Rapids. I'm a family nurse practitioner, but I moved here semi-retired a couple of years ago, and my mother had an acute stroke in December. And so we had healthcare providers at Essentia and at CHI and worked with hospice. And I can't say enough about the healthcare, and the entire system was fabulous in Park Rapids.
That's great to hear, Cheryl. Thank you for sharing that. I agree. I mean, and I'm not trying to toot my own horn here by any means, but I really feel like the quality of care that we provide in this community, given the size that we are, is pretty amazing. I always feel very comfortable telling my patients, yes, you absolutely should go to the hospital in Park Rapids because they're going to take very good care of you, and they're going to make sure that you get the care that you need and send you elsewhere if that's what seems most appropriate. And so I appreciate you saying that. I think it's really remarkable what we're able to do in a community this small.
I have a question. What's our current situation with COVID and how many people are dealing with it in our community, or how many have had it in our community, and are we getting herd immunity type thing yet?
We can safely say we do not have herd immunity. That would require a good 80% of people to have been infected, okay. And fortunately that has not happened. So we do not have herd immunity for sure. Our numbers have been dramatically on the decline, which I'm really happy to have seen. We've had about 1,500 cases in the county, in Hubbard County, with 38 deaths. And I don't believe that we've had any deaths in the county recently, secondary to COVID specifically. one of the things I think it's important to know is that when a person does pass away, what actually gets listed on their death certificate is the actual cause of their death. And one thing that people have gotten a little, I don't know, controversial about is, you know, if a person had COVID and they recovered but subsequently died, you know, we would not list their cause of death as COVID necessarily. So it's just an important consideration to be aware of. Our rate right now of infection is quite low. Our numbers have only gone up less than 2% in the past week. So, I mean, we've really got this pretty well controlled right now. I think part of that is because it's winter and most of us are hunkered down in our homes and not doing a lot, or if we're outside or with people, we're, you know, pretty bundled up and covered up and everything. We still have a long way to go. I hate to be the bearer of bad news, but we do. The vaccines are huge and that's going to help us a lot. But there's a lot of patients in our community, people in our community who are not going to be eligible for a vaccine for months. And you know, we've seen a lot of the spread of COVID historically has been, you know, young, healthy people going out, which is great. I'm glad that they want to go out. I'm glad they want to support our local businesses. I'm a big fan of all of that, but we have to do that as safely and responsibly as we possibly can, which means masking, which means social distancing, which means respecting the guidelines and the rules that are in place right now. You know, I've talked to some local business owners who, since the reopening of restaurants, they've been frustrated by the number of people who just don't want to cooperate with the rules. I mean, and their rules right now. So it's frustrating to see that, because I think we all want to support our local businesses and we don't want to see anybody struggle any more than they already have. So we're not out of it yet. The light is getting brighter, but the tunnel is still pretty long.
Thank you.
Mm-hmm.
Dan, I think you're muted.
Thank you very much. Thanks for letting me know. Thank you for all the information. And there, you know, there's a lot of unknowns. I think we can all take that into consideration for everything you told us. A lot of unknowns. Everything's changing every day. So just, you know, if you're out there and you have questions, just ask, and keep looking online. Probably to the Minnesota Health website would probably be the best place to get information. Would you say? Is that correct?
Yeah, I was just going to say the Minnesota Department of Health and the CDC have done just a phenomenal job with their websites and having up-to-date information. And so we really encourage anyone with specific questions on spread and processes to visit their websites. And then you can always reach out to our team here at Essentia, and I know Ben's team at the hospital. We're all working very hard to serve the community, protect our team, and protect the community. And just a huge thank you to everyone for the continuous masking and social distancing. I know it's challenging for all of us. You know, seeing people and human interaction is what usually fills our buckets, but it's very important, as you know, as we roll out the vaccination and get further into COVID and the herd immunity, you know, hoping we'll get there sooner than later so that we can, you know, go back to life as normal, as we call it. But thank you to all of you for doing your part.